Welcome back to Talk 1260 KTRC, Western Medicine, the Humanity Behind the Vanity. We now have a very special guest, our reflexologist, Tess De Gange.
Okay. Tess, so I'm going to sort of interview you today, and you're going to talk.
We'll talk.
All right. So here's my questions. I want to know how reflexology can affect your beauty. Physical beauty. We know it works on the inner beauty, and those are your points that you're going to give us in another time. But I'm just talking about the superficial. What are points, say, and you can tell me if there is no such thing, and that's fine. I just want to put it out there.
Okay.
Is there a point on your foot that can relax the tension in your face, which would therefore have the hopes of relaxing...
Foot or hand.
Foot or hand, right, sorry. Which one would hope then would relax the wrinkles in one's face. Such a point?
I would have to say that just touching the feet, just any sort of reflexology, it doesn't matter where you touch on the feet, it's going to relax you.
Yeah.
And you see it in the patient's faces when you start to work on them. Yeah. Halfway through, you just see, maybe they look like they're asleep, but they're relaxed.
Right, right.
So yes, absolutely.
Yeah.
Reflexology will relax the tension in your face.
Just in general, but there's no specific point like the pinky toe.
Well, the big toe is what I call the mother of all reflex points. If you can only massage one spot on the foot, the big toe is it. It's the seven cervicals, it's the side of the neck, it's the nose, it's the pituitary, it's the hypothalamus, it's the brain, it's the sinuses.
Whoa. Just
the big toe.
The mother.
It is. It is.
That's funny.
But I think just one good way for us, because a lot of people have a hard time crossing their feet on their lap and working on their own feet.
Right.
So in some of these, maybe it's in Asian shops or maybe even health food stores, they have these little racks that sit on the floor with all these little beads on it, these little wooden beads, and you could sit there watching television, rolling your feet. Now you think, oh, I'm just sitting here rolling my feet and this feels good and I'm watching my TV program, but what you're really doing is you're giving yourself a reflexology treatment.
Okay, interesting. So they have the physical rollers that you could take in your hand as well.
They do.
Is that the same kind of thing?
They do. I think, in my opinion, you'll press harder if it's on the floor and you're bearing down on it.
I agree.
If you're using it on your hand, it's all good.
Okay.
I mean, you'll get a good treatment.
Right.
But, the ones that sit on the floor, you'll get a better treatment. So.
Okay. So in general, you're saying the big toe is really the mother of the toes, and that will reach almost everything that's going to really affect your stress.
Correct.
And then in general, you're just saying just simply touching your feet and massaging your feet is
right. And if you have a partner, it's a lot of fun if you just sit across from each other and you put your foot in your partner's hand and your partner puts their foot in your hand, and you work on each other's feet. But I'll give you a little tip. Wherever you want your partner to rub on your foot, you start rubbing on their foot.
Yeah, Tess, in your dreams, baby.
No, it's true.
I don't know if that works. Just kidding. I'm kidding.
Well, you'll have to let me know.
All right. Maybe in your bedroom it works. No, I'm kidding. Okay, anyway, all right. Sorry. I'm sorry, Daniel. Okay. So, all right, let's think of something else. So, what else? What are some other points that you know of on the hands and or feet that do affect one's physical beauty, like their posture, their gut, if they suck it in, like the stomach muscles?
Well, affecting physical beauty, well, in all honesty, reflexology works on your organs.
Exactly.
So, I think any sort of massage is going to make you happy and relaxed.
And healthier.
And healthier. And
so eventually will translate to physical beauty, but
will.
It's not direct.
All right, well, here's an example where reflexology benefited somebody without the benefits of reflexology. It's a woman who had cancer, and while she was going through her treatments with the chemo and everything, she didn't want a full body massage. She was not comfortable with that.
Of course not. Right.
But what she says got her through it was the reflexology. Just the idea that somebody was touching her in a gentle way.
Right.
The
human touch.
The human touch.
Yeah. It can do wonders. Interesting. Yeah, I mean, reflexology is an ancient practice and has so many levels of benefits.
The relaxation and is great for my patients after their surgeries because they're coming in a week post-op and they're in pain sometimes, or nervous, or they were taking the bandages off and they're a little apprehensive about how it's going to look. And I think they walk out feeling much, much better.
Do you prepare people or work on them while they're getting injections?
I have.
Yeah,
I have, yes.
Yeah. I like doing that, and I think I might do that some more.
I thought that was good. I mean, I physically, I saw the physical relaxing happening. Can you say that?
Yeah.
I mean, I saw their hands relax. I saw their facial muscles relax as you were working on them.
We're doing so many liquid facelifts
Yeah,
now.
that's the biggest thing right
It's
now.
just
in
become
all
so
plastic surgeons'
popular
offices.
that,
Yeah.
I want to start to incorporate you again back into doing that, because I think it really
I was screaming
offers.
for you the last time you did my injections, which weren't so bad once they were in, but I was so apprehensive, so frightened, and just nervous. I always clenched my hands.
I heard you. I just couldn't get to you.
Right. And I was like, God, where's Tess? I need her. And I asked him, does Tess do this? This would be a great thing for your patients. He said, yes, in fact, she does. So, yeah, I bet you are just so welcomed when you're there doing that for the injections. I'm
Good,
sure.
Good.
All right. So, what else, Tess? So tell us more about reflexology and how it just affects the whole being, if there are little stress relievers that you can do to help yourself, because that does affect your outer beauty.
Yeah, exactly.
Yeah.
One of my favorite stress reducers is for those of us who do a lot of driving.
Yes.
And all right, we don't get a lot of traffic jams here in Santa Fe, but throughout your
It's
life
still
you'll
stressful,
get
yeah.
a traffic jam or something.
Yeah.
So I recommend that people carry a golf ball in their glove
That's
compartment.
great. I love it.
And when you're sitting there waiting for something to happen,
Right.
you take the golf ball out and you roll it around in your palms. You roll it around between your palms. So what you think you're doing is that you're taking your mind off of, I'm sitting here, hurry up, move. But what you're really doing is you're relaxing all your internal organs.
You didn't even realize it.
You're giving yourself a reflexology treatment.
What about while you're waiting in the airport for an airplane?
Well,
With
that's
a layover, same kind of thing?
You could do that even easier because then you're not driving. So you could take the golf ball and take your shoes off and roll your feet on it.
That's nice.
Right. Oh, that's good. That's good. Or in
That's
the plane.
nice.
It reminds me
Or
of that.
in the plane.
Yeah.
Yeah, that
Yeah.
Humphrey Bogart movie, The King Mutiny, when he was doing that with the balls. Obviously, that would.
But that's what they
relieve
use
the
those
Right.
for. Those
Uh-huh.
are stress relievers.
Right.
Right.
Just, yeah, non-medicable, but
Right,
yeah.
so
Right.
another thing that Tess has done is when occasionally I have a cancer patient in the hospital, like if I've done a big case, like a trauma, and we have one coming up when you do breast reconstruction. In the hospital, post-operatively, it's pretty stressful, and
Oh, of
Tess
course.
has made it so much easier for them.
I'm
And
sure.
nurses look forward to her coming.
Oh.
As does the patient.
Oh, I'm sure the patients.
Well, those are my favorite, really. The ones that are, that's a real emotional stress relief.
Yeah,
for
yeah.
them.
No, that's big time. You have cancer, that's beyond. Yeah.
Okay, we got to wrap this up. Thank you so much, Tess.
That was great, Tess. I look forward to talking with you more about these general topics of reflexology as well as more detailed topics.
Yes, thank you, and I want to thank our sponsors, the makers of Artifil, and the makers of the OnQ Pain Buster, which is something that works well with reflexology.
iFlow.
iFlow, yes, and
Good
we'll
stuff.
talk more about them later. So, thanks again. Come back next week. You're listening to Western Medicine, Talk 1260 KTRC. Thank you so much.